If you're a current Social Security retiree, what I'm about to share with you in few minutes could be the difference between struggling financially this year and being prepared for what's coming. Because right now, as we speak in January 2026, 71 million American retirees are about to feel the impact of 5 devastating changes that nobody saw coming, or at least nobody warned you about in time. And I know what you're thinking. You probably heard about the 2.8% cost of living adjustment, that COLA increase that's supposed to give you an extra $56 a month, and you're thinking that's good news, right? But what if I told you that by the time we're done here today, you'll understand why that $56 is actually going to feel more like $38 in your pocket, or even less for some of you, and that's just the beginning of what's hitting retirees the hardest in 2026. You are watching Income for Seniors, your trusted channel. We cut through the confusion and give you the real facts about Social Security, Medicare, and retirement benefits. No sugarcoating, no political spin, just the truth that affects your wallet and your future. And today, we're diving deep into the 5 specific changes that are hitting current retirees harder than any other group. Not future retirees, not workers still decades away from retirement, but you, the people who are already living on these benefits right now. And before we go any further, I need you to do 3 things. First, hit that subscribe button and turn on notifications, because these changes happen constantly and you need someone watching out for you. Second, grab a pen and paper, because I'm going to give you specific numbers and dates you'll want to remember. And third, share this video with anyone you know who's on Social Security, because what I'm about to reveal affects millions of Americans, and most of them have no idea what's coming. Here's what we're covering in the next 30 minutes. Change number 1, the Medicare Premium surge that's eating your COLA increase alive. And I'm going to show you the exact math that proves you're not getting what you think you're getting. Change number 2, why the 2.8% COLA won't keep up with your real expenses. And I've got the data from the Senior Citizens League that's going to shock you. Change number 3, how full retirement age hitting 67 is creating an impossible choice for millions of people born in 1960 or later. And this affects your benefits whether you've already claimed or you're about to. Change number 4, the expansion of benefit garnishment that could take up to 50% of your monthly check. Yes, you heard that right. Half your money could disappear. And change number 5, the Social Security office closures and service cuts that are making it nearly impossible to get help when you need it most, with 7,000 employees laid off and a 50% reduction in in-person visits planned. Each of these changes alone would be concerning, but together they create a perfect storm that's hitting current retirees harder than any other group. And by the end of this video, you'll know exactly how each one affects you personally and what you can do to protect yourself starting today. So let's not waste another second. Let's dive into change number 1, and I'm warning you right now, this one is going to make you angry. Change number 1 is the Medicare Part B premium surge, and this is the one that's going to hit you the hardest, because it directly reduces your take-home Social Security check every single month. And here's what's happening. On November 14th, 2025, the Centers for Medicare and Medicaid Services announced that Medicare Part B premiums are jumping from $185 per month in 2025 to $202.90 per month in 2026. Now I want you to really hear that number, $202.90. That's an increase of $17.90 per month, which works out to $214.80 per year that's coming out of your pocket. And this is the second highest dollar increase in Medicare. Part B history only beaten by the increase we saw during the COVID pandemic. And you might be thinking, okay, that's not great, but I'm getting a $56 COLA increase, so I'm still ahead, right? Well, let's do the math together right now, because this is where it gets really frustrating for retirees. The Social Security Administration announced a 2.8% cost of living adjustment for 2026, which for the average retiree means your monthly check goes from $2,015 to $2,071. That's an increase of $56 per month. Sounds good, doesn't it? But here's the catch that nobody's talking about. For the vast majority of Social Security recipients, Part B premiums are automatically deducted from your Social Security check. You don't even see that money. It's taken out before the deposit hits your bank account. So let's calculate your real increase. $56 COLA increase minus $17.90. Medicare Premium increase equals $38.10. That's your actual net increase, not $56, $38.10, which means that Medicare is eating 32% of your cost of living adjustment. Almost 1/3 of your raise is gone before you even get it. But wait! It gets even worse for some of you because the Medicare Part B annual deductible also increased from $257 in 2025 to $283 in 2026. That's an additional $26 increase you'll pay when you first start using Medicare services at the beginning of the year. So if we factor that in on a monthly basis, that's another $2.17 per month, which brings your real net increase down to approximately $36 per month. And for some retirees, especially those with smaller Social Security checks, this COLA increase can disappear almost entirely. Now, I need to explain something called the hold harmless provision. Because this is important, this is a rule that's supposed to protect Social Security beneficiaries from seeing their checks actually decrease due to Medicare premium increases. But here's the problem. This protection does not apply to everyone. It doesn't apply if you're new to Medicare in 2026. It doesn't apply if you're a high-income beneficiary paying IRMAA, which is income-related monthly adjustment amounts. It doesn't apply if you're not collecting Social Security yet, but you're enrolled in Medicare, and it doesn't apply to dual beneficiaries who receive both Medicare and Medicaid. So for millions of retirees, the hold harmless protection doesn't help you at all. This is why retirees are so frustrated. The headlines say you're getting a raise, politicians celebrate the COLA increase. But your bank account tells a completely different story, and here's what makes this even more painful. The Center for Medicare and Medicaid Services says the premium increase is due to projected price increases for medical services and higher utilization of healthcare by the aging population. In other words, healthcare costs are rising faster than Social Security can keep up, and you're caught in the middle. You need healthcare more than ever as you age, but the cost of that healthcare is eating your cost of living adjustment alive. Now, there is one small piece of good news I want to mention because honesty matters on this channel. The Trump administration did take action that saved about $11 per month on the premium increase. They eliminated wasteful spending on something called skin substitutes in medical procedures. Without that action, your premium would have gone up by about $29 instead of $18, so that helped a little bit. But it doesn't change the fundamental problem that healthcare costs are rising much faster than your Social Security benefits. And this brings me to a critical point I need you to understand. This is not a one-time problem. This is a trend that's been happening for years, and it's getting worse. Let me show you the history. In 2022, the Medicare Part B premium was $170.10. In 2023, it dropped slightly to $164.90, but that was an anomaly. In 2024, it went to $174.70. In 2025, it jumped to $185. And now in 2026, it's $202.90. Do you see the pattern? Medicare premiums are rising by 8 to 10% annually, while COLA increases are averaging only 2 to 3%. The math doesn't work. You're losing purchasing power every single year, and this affects your budget in ways that compound over time. Think about what this means for your monthly expenses. If you're like most retirees, you've got a fixed budget, you've got your mortgage or rent, your utilities, your groceries, your medications, your car expenses. Maybe you help your grandchildren, maybe you're still paying off some debt. You plan your budget based on the income you know is coming in every month. And when you hear there's a 2.8% COLA increase, you think, okay, I can afford to buy a little more at the grocery store. Maybe I can finally replace that appliance that's been broken. Maybe I can take the grandkids out to dinner a couple extra times. But then reality hits. That $56 increase you were counting on is really only $38 after Medicare. And after taxes, it might be even less. And meanwhile, your grocery bill has gone up by more than your Social Security increase. Your utility bill has increased. Your property taxes went up if you own a home. Your car insurance increased. Everything costs more, but your actual take-home income barely moved. This is the hidden crisis facing retirees in 2026. Now let me give you 3 specific action steps you need to take right now to deal with this Medicare premium increase. Action step number 1, go into your My Social Security account right now. Today, don't wait. Log in at ssa.gov and look at your actual benefit statement. Verify exactly how much is being deducted for Medicare Part B. Make sure the numbers are correct because sometimes there are errors and you don't want to find out 6 months from now that you were being overcharged. Action step number 2 during Medicare open enrollment, which runs from October 15th to December 7th every year. You need to shop your Medicare Advantage plans and your Part D prescription drug plans. Just because you've been with the same plan for years doesn't mean it's still the best deal. Premiums change, formularies change, doctor networks change. You could potentially save hundreds of dollars per year by switching to a better plan. Action step number 3, and this is important. Contact your state health insurance assistance program. It's called SHIP. This is a free service that helps Medicare beneficiaries understand their options. They can help you compare plans. They can help you understand if you qualify for any assistance programs like Medicare savings programs or extra help with drug costs. The phone number is 1-800-633-4227, and they can connect you with local counselors. The bottom line on change number 1 is this. Your COLA increase is not what it seems. Medicare Part B is taking a huge bite out of it, and you need to plan your budget based on your net increase of about $38, not $56. And for some of you, it's going to be even less than that. This is hitting current retirees the hardest because if you're working, you can potentially earn more to compensate. If you're not retired yet, you can adjust your plans. But if you're already living on Social Security, this is your reality and you have to deal with it right now. And that brings us to change number 2, which is going to show you why even that $38 net increase isn't enough to keep up with your real expenses. Change number 2 is why the 2.8% cost of living adjustment won't keep up with your real expenses. And this is where we need to have an honest conversation about what COLA actually measures versus what retirees actually spend money on. Because there's a huge disconnect here, and it's costing you purchasing power every single year. And the data I'm about to show you from independent research organizations is going to make you question whether the current COLA formula is even designed to help retirees at all. First, let me explain how COLA is calculated because most people don't really understand this. The Social Security Administration uses something called the Consumer Price Index for urban wage earners and clerical workers. The abbreviation is CPI-W. And they compare prices from July, August, and September of the previous year to July, August, and September of the current year. If prices went up on average, the COLA goes up by that percentage. If prices stayed the same or went down, there's no COLA at all, like what happened in 2010, 2011, and 2016. Now here's the first problem with this formula. It's based on the spending patterns of urban wage earners and clerical workers. These are working age people, not retirees. So the formula is measuring what younger working people spend their money on, not what 70-year-olds and 80-year-olds spend their money on. And if you think about it, that makes no sense at all. Working age people and retirees have completely different spending patterns. A 40-year-old spends money on childcare, work clothes, commuting costs. Maybe they're buying a house. A 75-year-old spends money on healthcare prescriptions, medical equipment, home modifications for mobility, long-term care. These are fundamentally different expense categories, but COLA isn't really capturing what retirees actually face. Now let me show you some data that's really eye-opening. The Senior Citizens League. This is an independent, nonpartisan organization that advocates for retirees. They did a study, and here's what they found. Since the year 2000, Social Security benefits have lost approximately 36% of their purchasing power. Let me say that again. 36%. That means if you could buy $100 worth of goods and services in the year 2000 with your Social Security check, today that same check only buys you $64 worth of goods and services. You've lost more than 1/3 of your purchasing power in just over 2 decades, and 2026 is continuing that trend. In fact, Shannon Benton, who's the executive director of the Senior Citizens League, made a statement that I think really captures the frustration. She said, quote, "The 2026 COLA is going to hurt for seniors," end quote. Now think about that. The person whose job it is to advocate for Social Security recipients is saying the COLA is going to hurt, not help, hurt. And she's right. Let me show you why. In an AARP survey conducted in September 2025, 77% of older adults said that a 3% COLA wouldn't be enough to help them keep up with rising prices. And we're not even getting 3%, we're getting 2.8%. So 3/4 of retirees were already saying 3% isn't enough, and we got less than that. Now let's break down the specific categories where retirees are getting crushed by inflation that COLA isn't keeping up with. Category number 1 is groceries and food costs. Food prices have been rising between 3 and 5% annually. And for retirees who are on fixed budgets and often can't take advantage of bulk buying at warehouse stores because they don't have the upfront cash or the storage space, they're paying even more. A dozen eggs that cost $2 in 2020 now costs $4 to $5 in many areas. Ground beef that was $4 a pound is now $6 to $8 a pound. Fresh vegetables and fruits have increased dramatically. And if you're on a special diet for health reasons like diabetes or heart disease, healthy food costs even more, so your grocery bill might have gone up by $30 to $50 a month or more. But your Social Security only went up by $38 after Medicare. Do you see the problem? Category number 2 is utility costs. Electricity and natural gas prices have increased by 4 to 8% in many states, and retirees spend more time at home than working people do, so they're using more utilities. You need heat in the winter. You need air conditioning in the summer, especially as you get older and can't regulate body temperature as well. You can't just tough it out like you could when you were younger, and with extreme weather becoming more common, those utility bills are hitting harder. I've heard from retirees whose electric bills went up by $50 to $100 per month just from last winter. To this winter, that's $600 to $1,200 a year. Where's that money supposed to come from when your Social Security only went up by about $450 for the whole year? Category number 3 is housing costs. If you rent, rents have been increasing by 5 to 7% annually in most markets. Some areas even more. If you own your home, property taxes continue to go up. Homeowners insurance has skyrocketed, especially in states like Florida and California. Home maintenance and repairs cost more. Because labor and materials are more expensive and many retirees are finding themselves house rich but cash poor, they've got equity in their home but they can't afford to maintain it or pay the taxes on it, and they can't easily downsize because moving costs money and smaller homes or apartments aren't necessarily that much cheaper anymore. Category number 4, and this is a big one, healthcare costs beyond Medicare. Yes, we already talked about Medicare Part B premiums, but there's so much more. You've got Medicare Part D prescription drug costs, and those premiums go up every year too. You've got co-pays and deductibles. You've got dental and vision care, which Medicare doesn't cover. You've got hearing aids, which can cost thousands of dollars, and Medicare doesn't cover those either. You've got over-the-counter medications and health supplies. You've got medical equipment like walkers or blood pressure monitors or glucose monitors. And if you need any kind of home health care or assisted living, we're talking about costs that can run thousands of dollars per month. The Kaiser Family Foundation found that healthcare costs for retirees are rising at nearly double the rate of general inflation. But COLA is based on general inflation, not healthcare inflation, so you're falling further and further behind every single year. Category number 5 is transportation costs. Car insurance has gone up dramatically for everyone, but especially for seniors in some states. Gas prices fluctuate, but they're generally higher than they were a few years ago. Car maintenance and repairs cost more, and if you can't drive anymore and you're relying on taxis or ride-sharing services, that's incredibly expensive. And in many areas, especially rural areas, there isn't good public transportation for seniors, so you're stuck either paying for expensive rides or becoming isolated at home.